Let's look at some of the more practical issue regarding the care of the dying patient, and I will start with issues related to the site of care about the dying patient. This is an emerging concept, and I will try to provide some good discussion to understand where the care should be for a dying patient, so that you can make a good recommendation to the patient and the family. So generally it can be like in the home, it can be in the hospital or specialized centers such as palliative care center. So as we work in the hospital, let's understand the advantage and relative advantage and disadvantage of taking care of a dying patient in a hospital. In a hospital, we have all the specialists available, so there might be better symptom controls and better access to relevant specialists and relevant healthcare professionals, including the nursing staff, physiotherapists, and so on. Sometimes it's actually is a necessity because there is an emergency admission and the patient needs to be admitted in the hospital, and they are looked after by a team of doctors in the hospital, in the ward, or in the ICU setting. Some of the patients actually do not want to be a burden on the family, and they want to be in the hospital so that the family can take some respite from the burden of looking after a dying patient, which can be very, very challenging. Palliative care, as I mentioned, is an emerging concept, but it's something that's increasingly being seen as an essential part of medical care. So the World Health Assembly describes palliative care as palliative care affirms life and regards, and I want to emphasize that, regards dying as a normal process, neither hasten nor postpone death, provides relief from pain and other distressing symptoms, integrates the psychological, spiritual aspect of patient care, offers a support system to help the family cope during the patient illness and in their own bereavement. So this is actually a very broad description of what palliative care is, and we need to again reflect on some of those key operative words, that palliative care affirms the life and regard dying as a normal process. It neither hasten nor postpone death. It provides relief from pain and other distressing symptoms, and as we mentioned that some of the symptoms we'll be discussing in much greater detail in the later part of this presentation. And it integrates the psychological and spiritual aspects of the patient care. Now, if we looked at the earlier presentation, that we talked about the need of maintaining the or providing optimum support to the patient so that their psychological and spiritual needs are important. And it also offers a support system to the family and extended family members, because during the dying process, the family goes through a lot of issues, and it is imperative that their needs are also looked after by the system. Now, in Saudi Arabia, actually the very few patients receive palliative care, and most patients who are receiving the palliative care are the cancer patient, and there are some unique feature of this care system. Now, one of the interesting data came from one of our colleague, Dr. Sami Ayad, and in a recent paper he said that per capita consumption of morphine in Saudi Arabia is about 0.35 milligram. It's a WHO data from 2011 in comparison with the global mean consumption of about 6.11 milligram. That means to say that morphine are not used as frequently as it should be in Saudi Arabia, and I understand that the situation is actually improving, and a lot more patients are receiving pain relief through morphine than it was in 2011 or 2010. So what are the barriers? The morphine use actually associated with the social stigma. We believe that this is a narcotics, and the patient or anyone should not, any other individual should receive it. There are actually concerns about the addiction and concerns about the side effects. These are not really true reason not to use morphine when there is a justifiable need, and a palliative care physician actually can provide better guidance and better pain relief for the patient. And in some cases, these are actually extremely important to relieve the pain of the patient. The palliative care also recognize that there comes a point when further treatment or investigation may be futile or even harmful. Essentially nothing medically can be done. Now, but the philosophy is to continue to look after the patient and care, but not to abandon them. That means to say that even when there is a futility of care is clearly apparent, we should still can provide comfort, support to the patient and as well as to the family. And it is also important to treat all their symptoms actively to provide maximum comfort and dignity to the patient. And again, the symptom relief are actually very, very important, and so perhaps it is more important than treating some of the odd laboratory values, as I stated earlier. Now, studies have shown that overall, the dying patient and families in palliative care, they receive more satisfying care than those who cared in the hospitals. And we need to think why it is so. We have to understand that people who are coming into the palliative care specialty, they are trained individuals to look after dying patient. And unlike the rest of the physicians who are trained to look after the living patient, the physicians who are coming into the palliative care, or the nurses or other healthcare professionals who are coming into the care of the dying patient, they know that this will be their job. So they are much more comfortable dealing with issues which are difficult for many physicians, such as talking about death, dying, providing symptom reliefs, and especially the pain relief.